April Lopez coming to you live from my car today. I'm about to get my daughter to school, but I want to share something with you that has been in my heart. And I think I always give God the glory for the healing in our office and everything we do. But I think God's been putting this in my heart. So I've had a few cases where I realized that I look like a crazy woman. So sorry. I realized that my patients are inadvertently, because it's not their fault, they're making wounds on themselves. So this is how that happens. I want to talk about this. This is called the CEAP, which is a comprehensive classification system for chronic venous disorders. And venous stasis is a very difficult thing to treat because it is very chronic. What does chronic mean? That means you have it for a long time. Okay, so venous stasis happens whenever you have a vein problem in your lower extremities. A lot of times we are heavier than we should be. I always tell people, I'm considered morbidly obese. My BMI is 31. We don't realize or understand just how important it is to maintain your proper weight until you start getting older and things start falling apart. So you could carry more weight than you should for a good 35 years, depends on how fit you are and your genetics. Once you hit that age, stuff starts breaking down. You start developing, sometimes a lot earlier, depending on your genetics and all your other comorbidities. So stuff starts breaking down. Your legs don't work the way they used to. Your knees start going, your ankles, and your venous. So you start seeing these little telangiectasis or reticular veins. This is a very important thing. I was sharing this with one of my patients. I want to show you this. This is all evidence-based, okay, data. So it starts like that little spider veins, purple veins, telangiectasis. As soon as you're starting to see that, one, you always need to be looking at your weight. Two, you need to remain active, but you need to go seek help because you need to do an assessment of your extremities to see if you have good circulation. Because then it becomes a varicose vein, then you get swollen, you have lipodermatosclerosis and eczema. Here's the important thing. You get itchy, and you scratch, which, by the way, I love Vaseline. Don't scratch. Put regular petroleum jelly and rub real good, and don't scratch because it's an itch-scratch cycle. This is evidence-based, guys. So you itch, you scratch, you itch more, you scratch, you itch more, right? That's why we tell you, if you have itchiness, don't scratch it. I always tell people, Vaseline, cold compress, hit it, like pat it. Scrub the top part, don't make wounds. We have nails, we scratch, we have staph on our skin. Lately, we've seen a lot, excuse me, I just came back, my husband and I just came back from an SAWC training. And the two organisms we see mostly on wounds are Pseudomonas, that good old blue-green tinge that leaves behind on dressings, and it smells really bad. You'll never forget that fishy smell, bitter, sour. And the other one is, of course, staph. So those are the two bacteria that colonize these wounds. So why? We have it on our skin, we scratch. When you have venous stasis, you have a lipodermatosclerosis and you get eczema, you get itchy. So what do? You scratch it. And so what happens? You make yourself a wound. Then you never look back. And then before you know it, especially if you're diabetic, you will have a big hole. Now you have an infection and you're like, why in 2 weeks did this happen? Because that's how it goes. So I want to share with you. Look, if you have family members that are diabetic, you're diabetic, look at your legs. Look at your feet every day. Check in between they're dry. Keep your toes clean. We're going to talk about nail fungus later. You will not imagine the problems nail fungus causes, including wounds, cellulitis. So look at the legs, including the upper legs, because I have patients that have venous stasis, usually the lower legs, but they have such bad venous system. The weight puts pressure on the venous system and it starts causing all this. They scratch and they scratch and they scratch because they're itchy. They have eczema. They're not doing it on purpose, but then now they have a wound way up here that nobody saw. So check legs, check calves, check in between toes. Keep an eye on those things. Go see your practitioner early. Don't let that go. And if you're itchy, don't scratch it. Go seek some help, a skin and a wound specialist that can help you heal. April Lopez, family nurse practitioner, adult geriatric acute care nurse practitioner, certified wound specialist, and certified skin and wound specialist. I've been doing this 26 years. I'm a nurse. I'm an advanced practice registered nurse. I own a family practice, and I do this for fun. I was talking to one of the Medicare surveyors, and I tell him, You want to talk to me about wounds? I'll talk about that all day. I'll talk about patient care all day. Why? Because I want to share information with you that is good for you, stuff that's going to help you or your family. And I'm making videos so it's out there forever. So when I'm long gone, this information can be passed on so you can be well and you can heal. And we'll see you next time.